I'm Dr. Scott Norton, a practicing endodontist in Louisville, Kentucky. In my practice, I see my share of patients who are simply difficult to get numb. It can be for any number of reasons, but there is no reason to ever treat a patient without them being profoundly numb when you have the XTIP in your arsenal. The XTIP is an intraosseous anesthesia delivery system that is pretty easy to use and delivers great results. Let me show you how it works in my hands. The first consideration with any anesthesia must be the patient. Good medical history will help you determine if your patient is a candidate. Always look at the radiograph to make sure you're using a drill in a safe anatomical area between roots and distal to the tooth that is being treated. I like to use lidocaine with 1 to 100,000 epinephrine. Because of the direct effect in the cancellous bone with the X-tip, you'll want to make your patient aware that they may experience an increased heart rate for a short period, but they're also going to get numb immediately. I will use 1/4 to 1/2 of a carpule. Sometimes I do both distal and mesial if it is really a hot tooth. In this case, we are working on an upper molar. We started with a little topical anesthesia in the area, then the local. I'm using a fast-acting anesthetic as well as a longer-lasting anesthetic in both the facial and the lingual. Let me show you the X-tip setup. The drill and sleeve are removed from the packaging. Here I am putting the drill into my standard slow-speed handpiece. The red cap is left in place till we are ready to use it to prevent accidental needle sticks. The 27-gauge needle that comes with the X-tip is put on the anesthetic syringe. I'll be using lidocaine 1 to 100,000. Now we are placing the drill a couple millimeters above the gingival margin and between the roots. Use gentle pressure. Touch the rheostat and through the cortical plate to the cancellous bone. You will feel the change in density. Go all the way to where the sleeve meets the tissue. I can hold the sleeve in place with my finger while I remove the handpiece. Now we introduce the anesthetic. The anesthetic is delivered slowly, right through the sleeve. While the directions say you can leave the sleeve where it is under the rubber dam, I always like to take it out. Within moments, I'm ready to go to work. I will always start with traditional local injections, but I don't hesitate to incorporate an intraosseous injection with the X-tip when the case calls for it. This is a tremendous resource for any dentist, and it doesn't have to be just for endo. Think of the times where incomplete anesthesia has kept you from providing the kind of care your patient needs. The X-tip may be the answer you've been looking for. Why don't you give it a try and see how it works in your hands?